Hi, I'm Mark Gallardo, glaucoma specialist from El Paso Eye Surgeons in El Paso, Texas.
So as we all go through our training, we're told to follow the science and practice evidence-based medicine. And of course, we've heard a lot about that in the last couple of years. But sometimes the science or the evidence that's available doesn't really mirror the type of patients that we're managing. And over the last 17 years, I've been practicing medicine here in El Paso, Texas, where over 80% of the population is Hispanic. And when dealing with glaucoma, we know that there are significant ethnic and racial variations in terms of how glaucoma presents itself and how it responds to therapy. But the current data that we have or the current procedures that are available for the management of glaucoma really doesn't provide us a lot of information on how Hispanics in general respond to this therapy, especially in the mixed realm. When we look at pivotal trials, a mere 5% of patients that are within those pivotal trials are Hispanic. And so over the last several years, I've been trying to share my data and how my patients respond to various mixed procedures. And recently, we were a part of a multi-center study evaluating the performance of 360 degrees of viscodilation and 180 degrees of goniotomy with the OMNI device combined with cataract surgery. And from that, we extrapolated my data specifically because of the 41 patients that were enrolled, 39 of them were Hispanic. And we found this important simply because this was a prospective study. And when we look at the Hispanic population in general, since 2010, there's been an increase in the Hispanic population, originally comprising 16% of the US population, increasing to 18%. This actually accounted for 50% of the US population increase within that decade. And there's some data to suggest that by the year 2035, a majority of patients with primary open-angle glaucoma are going to be Hispanic. And by the year 2050, half of all patients with primary open-angle glaucoma will be Hispanic. So the more we understand about this one demographic, the more we'll better be able to treat our patients. So going back to the study, again, I mentioned that this was a prospective open label, non-randomized study evaluating the safety and efficacy of combined cataract surgery with the OMNI surgical system, in which we were performing 180 degrees of goniotomy after we viscodilated 360 degrees of the canal. And we looked at my data specifically because of the Hispanic population. And we recently published that in Clinical Ophthalmology. And what we found was the patients did have a significant decrease in IOP and medication burden. Preoperatively or during their screen visit, they had a mean IOP of 16.5 on 2.0 medications. But when we look at clinical trials, we want to see what the overall efficacy is going to be on IOP and medication burden. So we had a washout period that followed all the typical washouts for different classes of medications. And in these patients, they had a mean diurnal IOP of 22.8 millimeters of mercury. And at 12 months, we reevaluated their IOP after another washout, and their IOP dropped close to 8 millimeters of mercury from 22.8 to 14.9. But when you want to look at kind of real world data and kind of how we practice medicine, we kind of also want to compare what they looked like before they were washed out and where they were at 12 months before their washout as well. So again, they started at 16.5 on 2 medications and ended up at 14.7 on only 0.15 medications. And that was a significant drop in their medication burden and also a drop in their IOP. Of note, at 12 months, 87% of patients were medication free. So it was a very substantial drop in patients' medication burden and also a drop in IOP. The adverse events for this study were minimal. No secondary surgical interventions were required for these patients for complications or for a need for reducing intraocular pressure. What we typically saw was hyphema, and that's pretty consistent with other angle-based procedures. There were a few patients after 1 month that had a pressure spike that was above 10 millimeters of mercury compared to baseline, and some with residual hyphema or iritis, but those did resolve without sequelae and conservative therapy. But the size and potentially unique characteristics of the Hispanic population underscore the importance of focused studies and the effectiveness and safety of this ethnic group. And of course, the OMNI combined with cataract surgery is found to provide a very safe and effective means of reducing not only IOP, but a patient's medication burden. And it should be noted, though, that the OMNI surgical system has been FDA cleared to reduce IOP in adult patients with primary open-angle glaucoma.